Hi, welcome to our Davenport University Fundamentals video. In this video, we're going to be talking about vital signs. Specifically, Brianna Camps is a DU student nurse. Myself, Allison Lertzma, is also a DU student nurse. Jacob Schmidt is a DU student nurse, and Kayla Sparks is also going to be a student nurse in this film. In this video presentation, we will be going over other vital signs, which is a critical way to measure critical physiological functions. They include temperature, pulse, respiration, and a two-step blood pressure method. Depending on the outcomes obtained, we will then be able to better know/understand the patient's state of health and functional ability of all the body systems.
An important nursing consideration is, first off, introduce yourself when you walk into the room. But before that, you must check the prescriber's orders as to what is necessary. Additionally, we must have two forms of identification from the patient. Instead of asking, "Are you Billy Bob Joe?" ask them what their name is, because many patients will just agree to it. Additionally, you can check the wristband, ask them to state their name, or ask them to state their date of birth.
Alright, now I'm going to be showing you the two-step blood pressure method on Allison here. So the first thing I'm going to do is have the patient sit down and have the arm rested at heart level. So she's going to rest her arm right here. And then I'm going to turn the patient's arm so that the palm is facing up. And also I'm going to palpate for the brachial pulse and place the blood pressure cuff about 1 to 2 inches above where you found the pulse. So we're going to look here for the brachial pulse. Alright, and so then I'm going to place the cuff on her arm, roughly 2 inches above where I found that pulse. Making sure that the cuff is tight to her arm. And then the next thing I'm going to do after I wrap the cuff around her upper arm is palpate the brachial pulse with my non-dominant hand and inflate the cuff using the rubber bulb in my dominant hand. This is the two-step method, therefore I'm going to feel for the systolic pulse or the systolic number before I actually pump the blood pressure cuff. Alrighty, so the number that I got right here was 130 before I felt the pulse disappear, and therefore that would be the number that I would add 30 to when taking the blood pressure again. So I'm going to wait 30 seconds here and allow the blood to flow back into her arm, and then I am going to take the blood pressure, and so I'm going to pump it up to 160 from the number of 130 plus 30 more, and then I will listen for the first sound, and that sound is the systolic blood pressure. And then when I hear that sound disappear, I will record that sound, and that is the diastolic. All right. So the first thing that we're going to do after taking the first step of the two-step process for this blood pressure, we are going to replace the cuff onto Allison's arm here. It's going to be about 1 to 2 inches above where we found the brachial pulse. So I'm going to have her lay her arm out like this, resting, and we're going to make sure to match up the cuff to the front of the arm. Make sure it's as tight as we can, but not too tight to hurt the patient. So I'm going to be holding the bulb here in my dominant hand and the bell of my stethoscope in my non-dominant hand. I'm going to place this here over the brachial pulse, and we remember that number of 130 plus 30 more, which would equal 160. So I tighten the bulb here, and I'm going to go ahead and listen. Alrighty, so the blood pressure that I got there was 112/70. So that would indicate that the systolic pressure was 112 and the diastolic was 70. that is a normal blood pressure for a young adult, and that would mean that Allison is healthy and strong. So then that is your two-step blood pressure method, and we use that in most hospital facilities to make sure that we are not hurting the patient at all with our procedure, making sure that we're not pumping up the blood pressure cuff too tight.
So the next vital sign that we're going to be taking is oral temperature. In any healthcare setting, you might have a variety of options. We're going to have the digital, glass, or plastic. In a glass or plastic, you're going to have the liquid, in which you need to shake the liquid down and wait for it to go below 98. This is found on page 429 in our Fundamentals, Theory, Concept, and Applications book. The next step is going to be removing the probe from the body. This is going to turn on the temperature. Next, you're going to slide the probe into the plastic sheath until the top part pokes out. This provides a barrier to prevent transmission of microorganisms. The next, we're going to ask the patient to lift up the tongue and place underneath. Then we're going to tell her to close her lips around it and try not to bite down, and wait until this beeps. You can open. The next step is going to be to read the temperature. The temperature is 98.9. The normal oral temperature is 98.0, so this is considered normal. After done, you're going to remove the plastic sheath into the wastebasket. After removing, you're going to place the probe back into the body to turn it off. The next vital sign that we're going to be taking is pulse oximetry. This device is measuring the peripheral oxygen saturation level. The first step is to turn the device on. The next step is to apply this meter to an unpolished, unabnormal finger. In this instance, she does not have any IVs or blood pressure cuffs on. But if she did, we would want to apply it to the opposite finger in order to less strain on the finger. We will now wait. Perfect. Thank you. The reading is 98, which can be found in our Fundamentals book as a normal reading.
So we'll be taking her pulse today. We normally take a pulse for 30 seconds from the radial pulse, which is directly below the thumb on the wrist. You use your two pads of your fingers, not your thumb, to take the pulse. And so you normally take it for 30 seconds unless there are any irregularities. And then if there are, you continue to count the pulse for a full minute. Immediately following taking a pulse, you'll count the patient's respirations. You do this so the patient doesn't change their respirations, because patients will change their breathing patterns if they know they're being observed. So for the first 30 seconds, I'll count pulse, starting with the first beat, and then the respirations, it will be the first full cycle. So any half cycles will not be counted. So for her pulse, I got 40 beats in 30 seconds, which is multiplied by 2 for 80 beats per minute. And then I immediately counted her respirations, which I got 8 respirations over 30 seconds, which means she has a respiratory rate of 16. Both of those numbers are within normal limits. Average pulse is normal is considered 60 to 80, while average is 70 to 80. Respirations, anything less than 12 is considered low, and we don't want to see that number above 20, so she is within normal range. Many people refer to the fifth vital sign as pain. Pain can tell us a lot about our patients, and when we assess for pain, we will look at the quality of pain, the duration of pain, the intensity, as well as the intensity of the pain. When assessing pain, it's with what the patient says. If the patient says they have a lot of pain, we have to treat it like they're in a lot of pain. So to get a numerical value, so we are able to understand what type of pain the patient's in, we often use a numerical scale for patients who are able to understand it. It ranges from 0 to 10, with 0 being the patient has no pain and 10 being in severe pain. With these numerical values, it allows us to interpret the type of pain that they're in, as well as what type of nursing interactions that we should implement. For younger children, we often use the Wong-Baker scale, which has 5 faces of provoking different emotions. So you can instruct the child to point to the face that represents the type of pain there. If they're smiling, they're probably not in pain, but if they're crying, they're probably going to be in a lot of pain. This allows us to understand what pain level children are in, even though they are not able to necessarily verbalize the type of pain. These pain scales, as well as the types of pain, we found in the book called Wong's Nursing Care of Infants and Children on pages 145 to 151.
Before taking any vital signs, make sure to keep an appropriate distance between you and your patient to ensure any cultural considerations are not abused. Also, if your patient has a preference of having a male nurse versus a female nurse due to their culture, make sure that is taken into consideration as well. Obtaining vital signs is very important. They can say a lot about the body and its functions. It depends on the healthcare setting, but vital signs can be taken either every 4 to 8 hours or monthly. Main points from our video presentation include the following. The normal body temperature ranges from 97 to 100.8 Fahrenheit. The hypothalamus is the control center of body temperature. If temperature is recorded higher than normal range, it is considered a fever. If temperature is recorded as lower than normal range, it is considered hypothermia. It can be measured in the mouth, rectum, axilla, tympanic membrane, and skin over the temporal artery. Safety concerns while taking the temperature include knowing how to use the equipment properly and shaking of the glass tube of oral temperature beforehand. Pulse is defined as contraction of blood being pushed out of the heart and pressure that exerts on the walls of the vessels. A normal pulse range for adults would be 60 to 100 beats per minute, but the average is normally 70 to 80. To obtain the most accurate pulse, an apical pulse is measured through the use of a stethoscope. One pulse contains the lub-dub sound. Factors such as developmental level, gender, exercise, stress, fever, and blood loss affect the pulse rate. The exchange of oxygen and carbon dioxide throughout the body during inhalation and exhalation is known as respiration. It consists of 2 aspects, chemical and mechanical. There can be many variations in the different types of respirations due to depth, rate, and rhythm. Examples as such would be wheezing, raunchy, crackles, stridor, and stertor. Measuring respirations is normally done by watching the rise and fall of the patient's chest over 1 minute of time. A pulse ox device may also be used to measure the respiratory status. Blood pressure is the pressure of blood as it is forced against the arterial walls during contraction, which we obtained from our fundamentals book, page 446. It splits into 2 different parts, systolic and diastolic. Instruments used to take blood pressure include a stethoscope, blood pressure cuff, a sphygmometer, or an electric blood cuff. A normal blood pressure would be 120 over 80. Anything higher would be considered hypertension, and anything lower would be considered hypotension. Blood pressure is regulated by 3 factors: cardiac function, peripheral vascular resistance, and blood volume. In our video, we choose to do the 2-step blood pressure method. We chose to do this because it allowed us to better gauge where our patient's blood pressure would be, avoiding any safety concerns regarding overpumping the blood pressure cuff. We hoped you enjoyed our video and were able to better understand how to take vital signs and the importance they serve.